So I'm Dr. Rajeev Bhasin. I'm a GP, I'm a physician. I've been practicing for the last 45 years. This machine that we have here is the kind that doctors use. Here are two kinds, the mercury variety, which is cumbersome to carry around, and these ones which have a dial. You also have the electronic machines which you can keep at home and check. Number one, relax and do it. Number two, the norm is to do it on the left arm. Blood pressures are lower in the morning, higher in the evening. They are also least when you are standing, mid when you are sitting, and maximum when you are lying down. When you worry about your blood pressure, when you worry about going to a doctor's clinic, at that point your blood pressure is elevated. So it is advised that you go to a doctor's clinic, relax for 5-7 minutes, and take the blood pressure after sitting. The arm should be rested on a table or cushion. You should have your sensor with an electronic which is marked with an arrow over the pulsation you feel at the elbow. This is the brachial artery, and the cuff should be 1 inch above the line of your elbow. If you are using a manual machine, very simple to do, your doctor will teach you. I will give you the basic guidelines. Keep the pipe away from the artery. Put the stethoscope on the inner half of the elbow and wear the stethoscope with the earpiece pointing forward because your ear canals go forward. Place the piece squarely with regular pressure on the elbow and inflate the blood pressure cuff, putting your finger on the pulsation. When the pulsation disappears, elevate it by 20 to 30 more and let it drop about 10 to 15 mm or readings per second. Now as it stops, as it falls, you will get a sound. When the sound starts, the pressure is, that is the systolic, and when the sound finishes, it is the diastolic. In pregnancy and in certain people, the sound might not finish till 0. That does not mean that their lower pressure is 0. It simply means that you have to look for muffling and not disappearing of the sound. I'll explain. The intensity of the sound is muffled. That is the point of the diastolic. So the frequency of checking. If this is the first time that you come up with a high blood pressure reading, then you will have to chart your blood pressure twice a day over 3 to 7 days to find out what the readings are coming. But these have to again be in a stress-less atmosphere, relaxed, and similar times of the day. On the same arm, same posture.